we would like to present a new protocol for the regeneration and the tropical hair care for men and women. The protocol allows us to restore the hair after its loss, both in genetic alopecia cases and to maintain and improve the hair's quality and look when occurs a dystrophy as a result of aging and improper care. To restore the hair covering, it's necessary to follow the classical regeneration protocol. We are already familiar with this protocol. It allows us to activate the dormant, sleeping stem cells and stimulates the proliferation and metabolism of the new hair follicles by using the platelet growth factors. We are aware that when the hair falls out, the stem cells located in the capillary tissue remain dormant. By properly stimulating these cells, they can activate and form new hair follicles. To activate the sleeping stem cells, we need to inject into the target zone a very small concentration of oxygen-free radicals, precisely 0.34 millimole. We can easily obtain the right amount by mixing ascorbic acid and trivalent iron. This concentration helps us to boost the cell's differentiation. A small concentration of free radicals activates the stem cells, stimulates their differential that leads to a new hair follicle's formation. The process of the stem cells differentiation completes in 21 days. That means that we can stimulate their proliferation and metabolic activity by using the growth factors. It's very important to conduct the separation process strictly according to the described schemes, in order to obtain the correct concentration of growth factors from the platelets of the patient's blood. Alternatively, you can use a product that already contains the main growth factors in an optimal concentration to stimulate the proliferation and metabolism of the newly formed bulbs. There is a big variety of growth factors, but one of the most important ones is the transform microfactor. It activates the SMAD2 and 3, which stimulates the proliferative and metabolic potential of the newly formed bulbs. The hair regeneration protocol includes the activation of the dormant stem cells every 6 months and at least 3 sessions of the platelets growth factors administration, which should be done once a month after the regeneration procedure. However, the most recent scientific studies have shown that there is a certain amount of stem cells that do not respond to the stimulation that we described earlier. These cells do not respond to the stimulation with a small concentration of free radicals or growth factors. It happens because of the lack of lactate, which is necessary for the evolutionary and proliferating process at the mitochondrial level. These studies emphasize on the importance of the direct lactate administration to achieve a positive result, since this component contributes to the formation of new bulbs. Thus, we need to use a new mesodrug which contains lactate in addition to transform microfactor 2, very important for the internal activation of the SMAD2 and 3 that boost the transcription process at the DNA level and leads to a new synthesis of the hair's structural components. The process of the stem cell activation, differentiation, proliferation, and consequently better hair nutrition requires a proper blood supply with nutrients and oxygen. For this purpose, we added into the new mesodrug the nicotinic acid. Nicotinic acid formates PGE2 that leads to an arteriovenous anastomosis relaxation and consequently to the vasodilation, guaranteeing a better blood perfusion in the areas that we want to regenerate and improve the trophicity. We add the mesodrug with active ingredients to the protocol described above. The mesodrug contains lactate, which activates the dormant stem cells, transform microfactor beta 2, which is the main activator of the stem cell's proliferation, nicotinic acid in the form of methyl nicotylate that improves the blood's perfusion process, amino acids precursors of the main hair keratin protein and vitamins such as pantothenic acid and biotin necessary to optimize the follicle's mitosis. Therefore, we offer a new protocol for both restore and maintain a good hair quality. First of all, we start from using the new mesodrug that allows us to optimize the regeneration environment. In a week, we need to activate the stem cells by using free radicals in a small concentration. After that, in 3 weeks, when the new hair bulbs are formed, we have to activate their proliferation and metabolism by using the growth factors, taken either from the patient's platelets or by using the biomimetic PRP, PRP biomimetic. We repeat the PRP procedure once a month for 3 times. Then we need to wait for 3 more weeks and perform the mesotherapy session again, once every 3 months. Then we have to observe the result and, if needed, repeat the entire cycle. To improve the results, we recommend to use a lotion that dilates the blood vessels in the scalp and facilitates the penetration of the active ingredients with trophic properties, and to intake an endomodulator able to optimize the hair's metabolism.